Preparing for Ruqyah. To ensure that the process is in accordance with Islamic law, the room where the Ruqyah will be performed should follow certain guidelines. Here are some specific steps to follow. Remove any pictures or objects that depict living creatures or statues. Do not allow dogs into the room. Avoid playing music or smoking. Maintaining ritual purity. If feasible, it is recommended that those in attendance perform wudu to maintain ritual purity. Dress code and etiquette guidelines during Islamic healing sessions. Please note that all attendees must dress appropriately. According to Islamic teachings, women are required to wear a correct hijab, including niqab, and dress modestly, so as not to expose themselves during movement. It is also recommended to drape a thick blanket over themselves. Avoid wearing perfume. If a male Raqi is present, the woman should be accompanied by her mahram or relative or husband during the treatment. If this is not possible, the wife of the Raqi can be present, or a married couple can accompany her. Please note that attending the session with only one other sister or going alone is not allowed. Dress code for men. It's recommended that men wear loose clothing, avoiding tight trousers. In addition, avoid wearing gold jewelry or silk. When consulting with a patient, a Raqi will inquire about their problems and symptoms, taking into account their physical, psychological, and mental state, as well as their dreams. It's crucial for them to have a comprehensive knowledge of mental and physical illnesses to avoid any misdiagnosis. Now, before the Raqi starts the Ruqyah, he will educate the patient about the correct Aqeedah, as it is very important for the healing process and not to fall into the clutches of the lies of the shaitan. Normally, he should talk about the Aqeedah for 20 to 30 minutes, unless the patient already has the knowledge. Here it is very important that the Raqi has studied the Aqeedah with scholars of the Sunnah before studying Ruqyah. Guidelines for the Raqi during treatment. The Raqi should never physically touch a female patient who is a stranger. Even if he is wearing gloves or using a cloth, he must keep a distance of at least 2 meters from her, as explained by Ibn Uthaymin. The treatment begins with either a diyat, a collection of du'as, or verses from the Holy Quran, which are recited loudly and clearly. Some verses may be repeated multiple times for their strong effect. During a spiritual possession, there are several possible reactions that can occur, such as stiffening of body parts, facial contortion, numbness, fainting, epileptic fits, heat, fatigue, or even animalistic noises. It's essential to understand that not all patients' reactions are immediately recognizable. In some cases, the possessed may even react months after the initial possession. Therefore, a trained Raqi can make a diagnosis based on the patient's medical history and recognize if the symptoms are due to spiritual possession. During a Ruqyah session, there may be an instance when the jinn communicates. In such cases, the Raqi should ask the jinn questions and invite them to Islam. However, it's crucial to remain cautious and not engage in conversation for an extended period. This is because jinn have a tendency to lie 95% of the time. It's important to inform the patient beforehand about this tendency, as the jinn may attempt to cause conflict or lead the Raqi and patient towards shirk by providing false information regarding the seer. For instance, the jinn may provide false information about who created the seer, how many are in the body, or where it's hidden. During a Ruqyah session, the Raqi uses a variety of products to help the patient. These products include, but are not limited to, Ruqyah water, black seed oil, olive oil, costus, and rose water. It is important to use high-quality products, like SunnahCure, to ensure optimal results. After completing the Ruqyah, the jinn typically remains in the body of the patient. In such cases, the patient is required to undergo Ruqyah therapy at home. The Raqi will provide a therapy plan, detailing the necessary products and the specific ibadat worship that should be carried out. Within a period of 1 to 4 weeks, the patient should return to the Raqi and provide an update on any symptoms that may have changed. Based on the patient's feedback, the treatment plan will be altered accordingly until the symptoms are resolved. The importance of follow-up in Ruqyah therapy. When a jinn leaves the body, the patient may feel a sense of relief and assume they are cured. However, it is crucial to complete 1 month of intensive Ruqyah therapy and then revisit the Raqi to confirm if all symptoms have disappeared. This process also includes another round of Ruqyah, since some jinn can deceive and pretend to have left the body or converted to Islam. Proper training in Ruqyah studies emphasizes the importance of this follow-up step to ensure thorough healing.